North system, in the MWRA system, and you can see the trend line since February through April 12th. And so obviously this gives us a good indication, more so I think than our official case counts right now, of where we stand for what we're seeing for actual COVID infection in this area. And obviously the trend line is swinging upward a bit. We haven't seen that since probably early March, probably about early March. And so this is something to keep our eye on for certain. Obviously, our case count data, we're only getting officially the antigen tests and the PCR tests that are collected from a facility or a site. So we're only getting a half a picture through case counts. A lot of self-testing going on out there, or no testing at all. That's one thing that's discussed quite a bit now, is people just aren't doing any testing, whether it be because they confuse it with other symptoms of allergies or a cold, or because perhaps they're asymptomatic. Either way, testing is quite low right now. So I think this perhaps is good data to keep our eye on as we're thinking about ways to message to the community about what actions to take. Not that those messages will necessarily vary, but perhaps vary in intensity and how frequent we get those messages out about mitigation strategies. And so we can switch to, let's go to our local dashboard. If you have questions on any way, please feel free to ask. And so this is our Winchester website. Okay. And so the first chart will show you a week-by-week case count, again, of antigen and PCR tests. And, I just want to note that since for the past 4 weeks, we have had out of 150, sorry, what was it, Karen? We did a query on the past 4 weeks. We had 158 cases, and out of those 158 cases, we had 5 hospitalizations of people over 75 years old, and thankfully, no further deaths.
Jen, it's April 3rd. It's actually the weekly. Do you know what April 10th number is? We haven't gotten that.
No, for this week, we're in. No, we could do a query right now while you're here.
No, I'm just curious because you showed the waste cover data with the train going on. So I'm just curious if the April 10th data is going to.
Yeah, sure. Yeah, sure. We can do a query right now. Yeah. Yeah. Yeah, but so that is interesting, but we note the comparison. So we're an upward swing of the wastewater data here. We're seeing sort of where we're remaining steady. We had a slight uptick after February break, and that's where we're sort of remaining. So it is an interesting economy there. And that's our positivity rate. We are a little bit higher than obviously the state average. It is interesting to note, though, that if you see our denominator for testing, you can see that testing is down from where we were even a month ago. And that holds true all around. We don't include Reading and Stoneham here, but their positivity rates are actually slightly higher than ours, just of note. So we're not sort of an outlier here. I think everyone's experiencing a little bit of an uptick. The question is, what is that uptick going to look like a few weeks from now? We don't know the answer to that. Is Omicron BA2 going to fizzle out the way Delta did? Obviously, unanswered question. And again, that was the monthly count. And our vax data, we can talk about our vaccination efforts in 1 second. But let's switch over to the state data, because I think it's important to check in with the hospitalization and the death rates for the state. Nothing sure.
I just can't get in.
That's okay, if you want to do a main query down
Yeah,
there,
yeah.
that'd be great. Okay. And so this is the state's interactive dashboard, and so I'm sure a lot of people have already been here. And I think it's good to go to the overall trend lines, the overview of the trend lines here. And so we can look here at the hospitalization 7-day average here. And the deaths, the trend line for deaths is right to the right of that. If we slide over just a bit here. So as we know, hospitalization and death data does lag behind. Hospitalization is around 2 to 3 weeks after infection. So, we would expect to see, if we're going to see an uptick in our cases, we would expect these trend lines to follow suit. But we don't want to see that, and it's important that we don't. And I think the vaccinations are actually continuing to do their job in preventing hospitalizations and death. And in fact, if you don't mind, if you could go to the breakthrough information, I think that's really important data for us to look at. So while the case counts have gone up slightly, I do think that it is still important to note where we stand with severe illness. And this is a good indication of that. So cases in vaccinated individuals, and this is data that's accumulated since the outset of COVID, actually. So let's see, this is data reported through March 29. Didn't seem like they've updated it recently. However, so out of all COVID cases, this would be 8.7% experienced COVID-19 in fully vaccinated individuals. That's actually out of two doses. People who have received 2 doses are considered actually fully vaccinated. And then among all of those cases, how many experienced hospitalizations? It's still less than 1%. You can see 0.15% experienced hospitalization as a result of a breakthrough COVID case. And then far less than that, 0.04% died as due to a breakthrough case of COVID. Now, these are, sorry, this should actually be updated weekly, but it does say through March 29th. So that's the most recent data we have for that. Okay. Is there any other data you wanted me to pull up, or do you want to pull up this?
No, actually, you covered the wastewater when you started, and that was the one that I have been following daily in addition to the others. And yeah, I think that, thank you very much for the report. It was comprehensive, and it lets us know where we're at.
We do have non-COVID things. I can wait and table that.
You want to just pull up the school dashboard too? Because I know
Yeah,
we
sure.
talked about that last time.
Yeah.
While you're doing that, I will just say that, yes, it is fantastic to see that we're not at the kind of numbers we were at prior to Omicron, but that, yes, there are increases, certainly in terms of the wastewater. We were looking at numbers in the tens last summer. They crept up by the hundreds up to 1,000 in early December. And that was when the Omicron began to appear. And we shot up to 8,604 on January 5th.
Can they not see me?
Plummeted downward, and all of January and
They should
February.
see that.
And then we started the part of the scale that we were projecting there. So, put in context, the numbers, while creeping upward, they are not yet alarmingly high. They are relatively higher. There's an upward tick, but I think we just have to responsibly have a discussion now in light of all of that data.
So our reporting data goes from Sunday to Saturday. So we have 8 cases.
Official cases. So it's important. All right, so we do that. Is there something particular?
Just the trend line. I think, is sort of-
Below that,
Yeah,
sure.
'cause that was, that was added. Recently.
Yes.
This was great.
Yeah.
And so,
Yeah, I think it was just important to give context of where we were at the beginning of
Yeah.
2022 with the onset of Omicron, where we are now. So, yeah, that's, it seems to be following suit with community data as well.
and I'll just quickly comment, it's okay that, I think what's at the top of the dashboard, Jen Markin actually thankfully, added a little bit of the explainer so that people can understand where the case comes from. I think for those of us who are in the health professions, we sort of understand the limitations of report, but this is only self-report or things that they're finding out in schools. And so, it may or may not be undercounting, we don't know, but I think it's good to do it from a transparency perspective to say that the case rates are still relatively low and stable, but those that have been reported. And then the other thing that I think is interesting, just to quickly comment on, is the sort of hidden dashboard out of the surveillance school testing. It's sort of like, it's not as part of the sort of main page of the school dashboard, but it also exists. And when Jen and I met with Jen, we went through that, and the surveillance data in the schools is also quite low in terms of picking up any positive cases through surveillance testing. We recognize that uptake in the particularly middle and high school of kids participating in surveillance testing is low in the elementary program. And that's all on the website, 50%. So half the kids are being screened weekly, and there's not a lot of cases being picked up. So that's, I think, reassuring global assessment. So again, I think the echoes is this point, your point. There may be some community increases that may be happening. We have to just really keep an eye on that.
Yes.
Did you want to switch to other clinics and other buildings?
Oh, sure, yeah. So, and frozen. Oh, it did it. Great. Okay. So we had two clinics in April for vaccines, and we actually had one yesterday with 96 people attending, so that was great. An hour and a half, 96 people came through. I think it ran the gamut from. Did we have any people for first doses?
Yes, the kids,
Oh.
5 to 11, there were a couple,
Oh, that's
mostly
great.
5-year-olds,
Oh, that's great. That's good. But mostly booster doses.
for anyone over 12 weeks.
Okay, and Karen DeCampo for anyone at home is our public health nurse sitting in the corner over here chiming in. Thank you. Okay, and so these are Pfizer clinics. We don't have Moderna right now, but people have been asking for it. Although the CDC has relaxed their language around, switching brands to say that it is perfectly acceptable if you've had Moderna as your initial doses to get Pfizer now. And I suggest anyone who is a little bit apprehensive about that, they'll go to CDC and read about that with the recommendations, or you can call Karen and have a discussion about that. Our next clinic is booster only clinic, and that'll be at the Jenks on April 21st. Obviously, with the new recommendations around a second booster for people over 50 and anyone 12 and over who has certain medical conditions, will be able to take part in that clinic as well. So just pre-register and go online. I know it's a little tricky if people are having a tough time with that. The Jenks is offering help to register people online. So please take advantage of that. We're hoping to promote the booster clinic at the Jenks through the Meals on Wheels program as well. We're going to send home kits with a flyer. Basically explaining booster doses, what you need to know if you want to pass that around. And we're going to supply an KN95 mask and at-home test kit. So just package it up so that when the meals are delivered, they'll have all that, and we'll be able to get assistance with registering if they want to come, or if they are in fact homebound, we can continue to do those visits as well. We also have 2 testing clinics coming up. The PCR testing clinics will be free thanks to a subsidy by Winchester Leahy Hospital. So this Thursday, and it'll still be in Town Hall, and on Monday. And so these dates were created specifically to couch April vacation, first before the Easter school break. and all the gathering and traveling that might happen. And then on the Monday that everyone returns from school break, hopefully we'll take advantage of the free testing, especially on that Monday when they return to school. I really encourage kids and staff to take advantage of that as well. So it will be free. Again, just pre-register, and if you have trouble with it, feel free to walk in. We can probably help you out. Okay, so switching gear, unless you have more COVID questions, we can switch gears from it. Just a few activities of what we're working on now. Outdoor food events are really taking off right now. We have Inca Farmers Market, we have Town Day all coming up, and those are really involved sort of food events, which is a great thing for the community, but obviously food safety, there's a lot of discussions and a lot of safeguards that have to be put in place to ensure that those are safe. I do want to mention that, norovirus is something that is constantly circulating, and we're seeing it in our community. And so it's another thing just to be mindful of. Hand washing is key. So, and that applies not just to food events. So we're doing everything we can to make sure that those events are safe. But we also get other events, catering events, mobile food events, things like that. So this is really the season where we're super busy with food events. And I encourage anybody who's having an event to please contact us as far in advance as possible, because these conversations and this permitting process can be lengthy, especially if you're not prepared with the answers to the questions. So please contact us as far in advance as possible. It's also chicken permitting time. We have a lot of people who have chickens in town, some with permits, some who don't have permits. I suggest if you have chickens and you don't have a permit, please go online, read the regulations to determine if you should release someone who's keeping animals, meaning do you have enough land, that type of thing, to be able to be in compliance. And if you don't, I think you should reconsider having the chickens or call us and we can help walk you through it. But in any event, this year we're going to send out educational material about an avian influenza that's going around, mostly in the wild bird population. And so the concern is that you have domestic population of chickens commingling with wild animals. And it's really not a concern unless you have free-ranging chickens in your yard, which we only allow that if they're supervised. Free-ranging chickens. So in any event, we will send out a flyer about that avian influenza and how to prepare for it or how to mitigate for it. This is also pool and camp season. So we have about 10 pools that we inspect and we permit. Everyone wants to open Memorial Day weekend, so please contact us for the inspection at least 2 weeks beforehand so we can schedule that. Most pools don't pass with one inspection. That's why I say it'll take about 2 weeks if we have to return to get you open for Memorial Day. And then camps as well. Camp permitting is a very lengthy process, so there are a lot of pieces to it. It's not as if anybody can say, hey, I want to offer a program of sports to kids. Come on out, kids. Let's just hang out on this field for a day. It's not that simple. Obviously, you want to make sure everyone's safe. There are background checks, there's medical records. There's a lot that goes into it. So anybody who's operating a camp or thinks they may be a camp, please call me and let's have a discussion about that. Camps are based on things like the amount of time you have children in your care for a day, and how many days of a week you operate. And then we also have our geese control program, and I just want to, this is an annual report for FY21, but also an up-to-date status report for FY22. And it's the USDA, it's the U.S. Wildlife Agency that disperses geese for us. And so that's, we will be renewing that contract for this year to help keep our grass fields as goose-free as possible. So we will renew that contract as well. I'm not sure if I mentioned this last time, but FinCom did approve our budget, the Board of Health budget for the year, as well as the revolving fund. And the revolving fund will be presented at town meeting as a separate article lumped in with other revolving funds. That's the revolving fund that is specifically for the intake of revenues from our clinics, our medical clinics, our vaccination clinics, and the money is expended for the same exact purpose. So it's not part of the Board of Health general budget. And then this past Wednesday, we attended the personnel board to reclassify a pre-existing health inspector position from a management to a PT or non-management. And that's so it gives a position flexibility to earn overtime. If we have an inspector, sometimes nights, weekends are needed, and so we allow that person to earn overtime. If I can actually recruit someone, it's a little difficult. We posted last year and didn't receive any candidates who were qualified and or had experience, and the same as this year. I think I've had 3 applicants, so unfortunately, that's where we stand right now. Thank you.
The next item on our agenda,
I apologize. Jessica would be very upset if I didn't mention.
Didn't talk
She
about
worked
the
so
text.
hard to get this TikTok put together. So VTech Smart. So that'll be this Wednesday, and it'll be a Zoom format. So anyone can register in advance. I think you can go to our website and the advertisement will be there. We already have quite a few people who have registered for that. But it'll talk about tick prevention and all sorts of tick-borne diseases that you really need to be mindful of because they are prevalent. Ticks are prevalent everywhere, as are the pathogens. So please tune in for that. That'll be a fabulous talk. Unfortunately, Larry Dapsis, who did it for us last time, has an issue and cannot attend. So his coworker will be doing that for us. So that's great. The show will go on. And then obviously, again, medication take-back date, April 30th, and household hazardous waste date on May 7th. And these we will hopefully get robocalls out to remind the community as well about those events. And that's it.
okay. So we're going to turn our attention now to the 4th item on our agenda, which is a consideration of COVID regarding spring town meeting. We're very fortunate to have our town moderator here. I'd like to invite Ms. Heather Von Mering, if you would, to the table. Wherever you
In the area?
want.
Okay.
Yeah, just join the conversation. So,
Okay. Hello, everyone.
So thank you again for the extensive report here on where we sit now with COVID. And I'm really just going to open the floor up here to my colleagues and to town moderator, perhaps, who might like to speak first and let us know some plans you have. Or
Yes.
like to do that.
So obviously, since I was elected, not the session, but before, COVID has always been part of our discussion with staff. And so town meeting staff is a very robust group of people in this building. So we have Mary Ellen Lannon, the town clerk. We have Mark Tuga, the assistant town manager. We have the town manager. We have, it goes on and on. We have the DPW as part of it. We have WinCam as well, who joins in and participates. So there's a lot of people who are working on it. My perspective, and I've been very adamant about it, is that it is critical for our government at this time that town meeting be in person, and that we need to do everything we can to keep it in person. Going forward, we can talk about why that is if you'd like, but from my perspective, we need to be in person. Our government needs to return to seeing each other in person and not through computer screens anymore, for a town meeting specifically. Hybrid is not allowed in the state of Massachusetts, so we do not have that as an option. Full remote, if needed be, we could transfer quickly into a remote format in case if there's a tremendous spike and there's a huge issue. We can transfer to remote at this time, though the numbers are not showing that that would be needed. But it is in place. What it would cause is it would cause a delay. Most likely wouldn't start the first day of town meeting that's scheduled. We'd say we postpone it to the next Thursday and then start town meeting in full remote. So we'd give us some time to transition if we needed to full remote. The precautions that I'm allowed to do is I manage what happens inside the meeting, what everyone does, how they operate, how they behave. With that, currently, as of today, I have received tremendous amount of emails. I'm sure you have too, because there are some concerns that they want you to participate in creating some situations. But I received a tremendous amount of feedback from town meeting, and that really is who I'm there to support. So from that, there's a large range of what people's needs are. And my job is really to make sure that we meet as many as we can. And so as of right now, how I've set it up with all the town staff is that at the high school, that auditorium seats 795 people. There are 192 town meeting members, so we're at a quarter capacity. We can do assigned seating where everyone is spread out, so they're not in close proximity. I have zero intentions of doing a mask. That is coming, if that's required, that comes from your board. That does not come from me. So they'll be spread out throughout the entire auditorium. Usually staff is in the auditorium with town meeting. They will be placed in the cafeteria as of right now. We got to look at the plan actually and lay it all out and make sure if we can space them all out safely and put them in with us, we will be putting staff in with us because there's a lot of feedback coming on. But definitely the staff that will be present in the room will be the town council, will be the town manager, the superintendent of schools during the school committee's articles. So we will have staff in the room with us, but it will not be all of the staff. All the department heads are all at the meeting, as Murphy can probably, they have to sit through all of it. So that is currently where we're standing. I spoke to Jay Gill and he has provided the plans, so we could do a plan and hand it out to all the town meeting members to give them their assigned seats. Also, the HVAC system in the high school is the best system we have in all the buildings right now. So that is a good thing for terms of fresh air intake and turnover and the air quality in there. What I am also doing is town meeting members are allowed to be in their assigned seat. They are also allowed to watch. We're going to have televisions broadcasting in the cafeteria if they would like to go there. And some town meeting members asked if they themselves could take on, because we're doing all these different things, they could take on doing an outdoor projection. WinCamp is broadcasting and we'll be broadcasting it. So knowing that there's that delay when a vote is ready, I would be delaying to give them time to come in from either if they're outside, they're going to set their own projector and everything. They can come in from outside, or if they're in the cafeteria to come in and join us for the vote. Remote voting is extremely difficult and I am not in support of it because if their clickers don't work and I can't see them and I call the vote holds. Mm-hmm. So we need to make sure that when votes are taking place, we are all in the same space together. Mm-hmm. And so I will hold the vote to take it until everyone comes in. We'll mark out spots on the floor for them to stand that's spread out. They'll take the vote and then they can go back to where they're comfortable. DPW said they will be cleaning before and after town meeting. The microphones, as of right now, I believe the plan is that they'll be wiped so they can be wiped down before and after by each person who uses it. And there'll be Jeremy Gel, which is Purell. I call it Jeremy Gel. So my kids call it Jeremy Gel, available as well. And on top of that, N95s, I believe, I asked for specifically for N95s to be provided and available for anyone who wants them. So that currently is the plan for InPerson. And if we needed, we can pivot at any time. But there's more stuff we could do. Obviously, you can do a mask mandate that has to come from the Board of Health. I will not be doing that. There has been asked about, creating a space for immune compromised people. I am actually against that as well, just because that identifies them. So obviously where you're comfortable. If you want to be outside, you can be. If you want to be in the cafeteria, you're welcome to be. If you want to be in your seat, you're welcome to be. And all of them are in attendance. So those who you check in with the town clerk in the beginning, and then you take your, you checked in, and wherever you sit is where we're going to allow that to happen. Usually you have to be in the auditorium. And that's kind of where we're at right now. I know that you were circulating recommendations. I did not see them. I don't know if that aligns with what you would like to see happen. I'm happy to talk about what you would like. But the other problem we have is it's very complicated. So town meeting looks a lot easier to run than it actually is. There's a lot of things going on all around, from technology to accessibility and various. And now we have the voting machines, which no one's used to at all, period. So there's a lot of things that we're working through and have to navigate. So we just need to be aware of what impacts, if anything, if you put mandates on town meeting, what that will do.
Thank you so much. And I'll just make a couple of comments here that, yes, personally, and I suspect both my colleagues want to support you in every way that we can have an in-person safe meeting. That's why we just went through the data and we know kind of where we are standing. And in my opinion, no draconian methods are are called for. I'm not personally thinking in terms of any kind of mandates. I will note that many of the towns around us have moved to that, and some have started town meeting in person and had to switch because they chose to switch to remote. So it's good that you have that plan B. I'm hoping we don't ever have to go there, but it's great to know that you have that in place. When you were speaking, there were a couple of things that jumped out at me that I might want us to discuss a little bit about. Rather than assigned seating, I'm wondering whether we might want to have an area where it doesn't mean immunocompromised, but just masks. People who choose to have masks optional could be, or I don't know how we word it, but people who would like to be masked, who choose to have a mask if they can sit in a certain area by choice. That's one thing. As distinct from randomly or however alphabetically assigned seats. And I don't know the pluses or minuses of that, either practically or in terms of any sort of other considerations, emotional or other, that we might want to entertain. The other is that my understanding was that video could be broadcast to the cafeteria, but audio was hard. And audio, when Cam was telling me, the recommendation was to have assisted hearing devices, headphones that are given in addition to the video. So I don't know, that's a technological piece.
The last I heard is that WinCam can be broadcast on all the televisions in the cafeteria.
Right, that's good. I just wanted to say that. So my colleagues like to jump in and say anything. Dr. Slocum.
So I think maybe it's a good time to, thanks for talking about this. I think it's important that we all together think through what our role as a Board of Health is and should be in this situation, and recognize that it's very important that the town meeting happens in general, and then I think really important, as you say, to have it in person in a safe way. And I think as we're sort of in this place where COVID cases rise and fall and rise and fall, and we're sort of, not in a surge mentality, but in sort of a cautious mentality, large indoor gatherings are the things that I think raise people's concern more than things, on someone's day-to-day basis. Sort of similar to the school discussion where there's a lot of people at once in a place where they have to be. Town meeting members were elected to serve the community, and it's their responsibility to attend town meeting. And we want to make sure that we enable a safe way for every town meeting member to participate, regardless of their view on their own personal risk, or regardless of their vaccination status, regardless of their own mitigation strategies that they're taking in other parts of life. And I think as a Board of Health for the town, we're responsible for stewarding recommendations to support the best possible public health outcomes. And so what I have put together and which we circulated among the board is a series of recommendations which I would like us to discuss that really are recommendations. And I want to start by saying none of this, I have no appetite right now for a mandate, as well as we mentioned. But I think it's important for us as a Board of Health to, on paper, agree to a series of recommendations based on public health. And that series of recommendations, I think, has two categories. One, what mitigation strategy should be considered for the venue? And the second, what guidance should be given to town meeting members as well as town meeting attendees? Because I think there's two slightly different topics. So I think we, as a public health body, can develop and create a set of recommendations that then can be disseminated through you, as well as through the health department, to town meeting members and town meeting attendees to then say, this is what we think would be the safest strategy from a public health perspective. That may or may not always align with what's possible technically, legally, or feasibly, but I think it's important for us as a body to have a series of recommendations that are, that are agreed upon by our board. And so I have this document that I would love us to sort of go through. I don't know
I can project
if
it.
you want to project it up.
Let me, I apologize, let me see, am I still in the meeting? Yes, I am. Okay,
So I think the way this document is crafted is it starts by essentially first stating our role as the Board of Health under statute is to be responsible for formulation and enforcement of rules and regulations affecting the environment and public health. And that the Massachusetts State Department of Public Health globally recommends that people should be vaccinated and that anyone who is unvaccinated should be wearing a mask indoors. We are lucky that we live in an environment in a town which is highly vaccinated. And so the percentage of people who are unvaccinated who are on town meeting, I'm not saying we need to ask for vaccination status, but I think we as a government body need to continue to recommend that people who are unvaccinated get vaccinated, but also abide by the guidance that says if you are unvaccinated, you should be wearing a mask indoors. The state also recommends those that are immune compromised or who are around people who are immune compromised or at risk should also be wearing masks indoors, and particularly in large indoor gatherings. So the recommendations as were set forth here, and I think that's where we can discuss, again, divide up between venue and not. So I'll just go through them if that's okay, and then we can maybe discuss. The first, I think we just need to strike, because legally we can't do a remote, then we can just strike that line. I mean, I think ideally in an ideal world, I think many of us would have liked technologically to be possible, but I acknowledge that, so I think we just have to strike that as a recommendation because it can't happen.
Well, they can't participate through their own devices into the meeting, right? But they can watch and follow along and then come in to vote out. So it's kind of it's not the hybrid that they're talking about is where they're actually like on to what's going on right now for your meeting.
So that gets to I think later recommendations. So the second one I think is exactly what you've already said. Just again stating that COVID-2 is an airborne virus and we recommend distancing.
Yeah, which we're going to
So we recommend distancing and good airflow and ventilation. That's what that recommendation is. The second is you also already said, consider using other spaces at the high school to stream the meeting. Again, to allow for distancing. I think that is number 4 would provide N95 masks to attendees if they so choose. I think it would if that's a recommendation that is taken up, then the health department
I've already asked for that.
KN.
So we need to edit it.
And then the 5th was make available rapid antigen tests for use at the venue. That's a little bit more of a stringent discussion. Again, not requiring, and I don't think any of it says mandating people to take tests, but to have tests available in case anyone is either exhibiting symptoms or is interested in obtaining a rapid test. I think it would be nice to have the ability to have a rapid test available on site. As you know, these are tests that can be done and conducted in 15 minutes of consulting. Number 6 was spaced out seating, which we talked about already. Number 7 was a little bit what Bruce had mentioned, provide for one or more clearly marked mask-only sections within the venue. And that would ensure that that people who are choosing to wear a mask can feel comfortable that they're distanced and seated up with other people who are wearing masks. And I don't think that calls out anyone in regards to their medical conditions or their comorbidities, but it just allows for, I think, a sense of comfort for members who may want to be participating fully in the meeting in person, but perhaps be seated in an area where everybody else is also wearing a mask for their own comfort level. And I think that's something that, given the size of the auditorium, could be considered as a sort of seating option. It's also something that's been done at a few other neighboring town meetings. We looked at some of the other guidances that have come out from towns such as Bedford and Lincoln. And
I should have mentioned that I've been in close contact with all the moderators.
And so that's something that actually came out of several other towns that said seating was a mask section and then a mask optional section.
Yeah, the other thing to be very cautious of is a lot of those are not elected town, it's open town, so it's less them versus us mentality. And so that's one of the reasons I'm just cautious about it but
I didn't catch why. So they are open instead of elected.
yeah, so it's open, it's anyone, and then
Right.
so they're able to, there's a lot of division. And so it's just trying to balance it. But
I would say rather than
I'll look into it.
I would say rather than assigned seating, that's one option. But I think people can choose to sit where they want.
Well, you want them 6 feet apart, though.
But in a distance way. But I think again, this is from the public health perspective.
Yeah.
I think having a fully masked indoor environment is probably the safe. So if I put the public health lens on, and this happens at a lot of conferences that are going on now, workplaces, employment places. I just came from a conference where I was with colleagues where there was mask required throughout the conference. And there are a lot of places that do say in large indoor gatherings, we require masks, period. But if the choice is not to require masks, but to recommend masks, then I think having an option where there are separated seating areas, I think is again a mitigation strategy from a public health perspective. Then in terms of microphones, again, restricting seating near the microphones. Microphones is where an area where people will, if they are masked, take off their masks potentially to speak. And so again, because of airborne transmission, the safest thing is to have the microphones distance even further from seating areas so that there isn't people sitting right at the microphones again, as a sort of a mitigation measure. The time of the meeting and making sure that the meeting is run in sort of a timely fashion, the more time people spend indoors, the more time there is potential risk. And so again, looking at it from how the agenda is run, again, from a public health perspective and not from a governmental perspective, the shorter the amount of time that people are in a room together in a large crowd, the safer it will be for everybody. And so trying to make sure that time limits are enforced for speakers, as well as thinking about procedures like a consent agenda to expedite voting, perhaps on articles that don't require as much debate or time or lumping things together, or presentations that could otherwise be done remotely or in advance might save and cut back some of the time. So those were the sort of venue strategies that I put forth.
So there's already a consent agenda coming in, just so you know. The time limits is for the speakers are set by the town bylaws. So that is all set there. And that is we clock them.
The
The town
sitting
clerk
near
clocks.
the microphones, the primary microphone is probably, Greg, far enough away. It's like a good 6 feet at least from that first row, which we could also restrict seating in the first row if that seemed like a good thing. But what about the ones where on either side? Those be a little tricky. How would we deal with those?
Oh, with those, what I was thinking is the ends is closing those off so no one sits there. But
Yeah.
the other thing is what I plan to do because I've never done the in-person, so no one actually understands how I'm going to call on people, but I am not going to cherry pick. My goal is to have the microphones and have people line up and just go back and forth between the microphones. If so, first come, first serve in the order. And what the thought was is around those microphones is there's not going to be seating, but there'll be seating in case you're standing in line, you can sit because some members will wait in that line. In some articles, they can actually wait for quite some time. So there'll be seats, but they'll be spread out where they can sit and wait in their turn. And then move.
And then like 6 foot tape marks or something for one.
Then the other side of it too, though, is also those who need to be on the outside cat for specific accessibility purposes.
So, I mean, it's nothing I think here is, it seems like most of these things are things that have already been thought through or are feasible. And then I think that's what we can continue this discussion, but I think there's nothing here that is written in language saying that it's mandatory, but it is all mitigation strategies that I think will be sort of at the level of protecting from a public health perspective and mitigating risk for those who choose to attend the meeting in person. Then the second thing is really around guidance for those who are attending. And I think it again comes from public health guidance. This comes from public health guidance that supersedes what the town public health guidance is. It's really the state, national CDC guidance. Attendings should be up to date on their vaccination, including boosters as a public health recommendation. Attendings should be encouraged to test with a rapid antigen test on each day of town meeting. I think that that's a very fair thing to ask attendees to do. We're talking about that with travel, with going to see family, with going to relatives. We are going to be in a group of people where there are people who surely are immune compromised, people who are having comorbidities, people who are more senior. We have a large group of people in town meeting of various ages and demographics. And so I think that recommendation, again, is not a requirement. The recommendation that testing happen either at on-site or at home before people attend, I think is a fair one from a public health perspective. I think it needs to be stated that attendees should not be attending if they have any symptoms of illness. This is what we tell people: don't come to work if you're sick, don't go to school if you're sick, don't go to town meeting if you're sick. I think it has to be a very important message. I think it's important to strongly encourage mask wearing in town meeting, and particularly that say that unvaccinated people should wear a mask for guidance from the Massachusetts Department of Health, and those who are in increased risk because of age, medical conditions, or other household members should also be wearing a mask. And that again comes straight out of the Massachusetts DPH recommendations. We need to put it again, I think the language there in number 5 is if someone in an attendee household has COVID or they've been exposed to COVID, there are, again, just like with the school, what to do if you've been exposed to COVID or someone in your household has COVID. The recommendation is that a mask is worn at town meeting if it's been within 10 days of that person being positive, or the attendee should not attend in person. And this is again coming from Massachusetts DPH guidelines. And anyone who's considered a close contact with infected also needs to follow the isolation and quarantine guidelines. And I think it's coming again as a recommendation for town meeting attendees, again in line with what the state is saying. And then number 6, attendees are encouraged to distance from each other as much as possible. And I think that would include coming up to the microphone, so making sure that when people do line up at the microphone, the adequate distance is kept. And I think the last to allow people to remain masked while speaking. I understand that some people would feel comfortable taking their mask off if they are masked, but I think some people may feel like if you're coming up to the microphone, that they should be allowed to continue to be masked. So again, these are guidance statements that I will welcome my colleagues' comments on that I think come straight out of public health recommendations and are totally in line with what other large gatherings, whether they be in government or other settings, are already doing.
Just want to confirm, you're in agreement that the high school has good airflow, correct?
Yes.
I believe that is true. Yes, it is the best in the town. So
I do, Ruth,
yeah,
quickly, I did, at last night's select board meeting, I did hear that there was a question about.
I've already asked for that to relocate to the high school, and so if they need to change the date. So for those who are listening in, the select board last night requested that the special town meeting be moved to a date that did not work with the high school and voted to have it at the middle school. And so I've reached out to the manager's office today saying, no, you need to get it back in the high school. So you need to change the date to line with the high school. The middle school doesn't have the capacity the high school does, or the ventilation system, or the space in the cafeteria. It's not as easy to manage, and they don't have the technology either. So that currently is on the works right now. Unfortunately, there's just a miscommunication going on. So the goal is that okay, so can you clarify, you putting this out, or are you saying you want me to take your recommendations?
what I'd like
What
to
is
do
the action plan?
is just make sure we're all on the same page regarding the small changes that would be made on this. I would recommend that we then take a vote as a board that these are recommendations to you, and you obviously are the person who runs town meetings. So these are only recommendations for you to interpret from a health perspective. And it sounds like there's tremendous agreement on how all of these would play out. But I had, Madam Moderator, it is absolutely in the spirit of a recommendation that these would be given.
Mm-hmm.
But in my opinion, we should probably take a vote on these recommendations. The changes would be to delete the first one because it is technologically not possible to have a remote option. And then further on down and 4, just to note that they are KN95s.
Yeah, so I just have a couple
Yeah, go
questions. So I think making rapid antigen testing available on site for 192 people is not a reasonable ask. I think that recommending testing before attending, to me, seems more reasonable. I think that should be taken out. And the only other thing I want to say that, which Heather just said, which I think that we probably don't have a high level view of, is that there are some ADA compliance issues and seating issues that you're going to need to work around with the venue. And so I do think that saying that there's and I also just feel like having a mask only section and a non-mask section just seems divisive to me. And I'm not saying that that was the intent.
Masks optional.
Right. So that's what I'm saying. So mask optional and non-mask optional to me seems a little, I don't know, it seems a little us versus them to me. And I think that this is what a lot of what I'm trying to get past in this town. And I think that the reasons people are wearing masks are all different. And I think that being inclusive of all of those people and everybody who's attending is what's important to me. And I think that as one of the recommendations of being a good human and not intentionally doing something that is not kind to people at town meeting. But I do think that with the ADA and the other restrictions and all the other things that you have to put into place for seating, I think that people have the option to wear masks. We're going to make sure their distance. I do think that having a masking section and a non-masking section seems a little unreasonable to me.
And I, Maria, through the flip side, the other option would be to say, we recognize there are lots of people that potentially are at risk for various reasons or care for people that are at risk. So, I mean, it is within our right to say we would mandate that for this indoor event, everybody wear masks. That takes away the us versus them. And says from a public health perspective, masking a large indoor venue is the safest way. And that doesn't shame anybody into sort of revealing why they may or may not be wearing a mask. And so in some ways, to me, if you don't separate out or have sort of an opportunity for people who are worried about their own personal situations, the more easy way is to just say everybody should wear a mask.
Everybody must.
Yeah.
Well, there's two different ways to go about that. So are you wearing a mask because you're just recovering from COVID, or you're unvaccinated, or because you don't feel comfortable? Those are three very different reasons as to why you should wear a mask. So should you be sitting next to the most immunocompromised person in the room, even though you're masked? That's one question. The second question is, I just lost my train of thought, sorry. But if we truly feel that a mask mandate should be where we are after we just saw that data, then that's what we should be doing. But we all don't feel that there should be a mask mandate for this venue because of the data in the town. So that's the second point. The third point that I have is there are probably just as many children in that auditorium every day. There have been multiple plays, multiple events, and multiple other things happening in that school that do not have a mask mandate. So the question to me would be, why would town meeting be some protected class that would be different than the kids that are already in that building that are mandated to be in that building? And why would we view their health and safety differently than the other people in the building? And so the mixed messaging to me is also a really difficult thing, because if we're saying the building is safe, we're saying the building is safe for our students to be in it unmasked together, then to me, that's a missed message to say and again, currently with the data on the table. Now, if the data changes in 2 weeks and the kids need to go back to masks or anything else, that's different. But with the data on the table, we don't feel like a mask mandate is what we need right now. So all I'm saying is that I would like to give the moderator her due process to ensure a safe town meeting, which means that people will be spaced out, people will be masked if they choose to be. And I think in my mind, that's the safest way to do it, because that way you're not sitting people who are just recovering for COVID in a mask next to somebody who is completely immunocompromised. So in my mind, that would be the safest way to do it. But I get that it doesn't really matter, I think. But I mean, the reality is and I think that the testing on site causes problems. And I think it also exposes people to germs and swabbing and all those types of things that I think is unnecessary.
Maureen, I think your opinions are very valid, and I think let's talk about the testing thing. I'm happy to sort of keep the recommendation in around.
Yeah, I think we should recommend people to test before.
So
It isn't.
No, it's not.
So I'm happy to take that recommendation out from the venue. That said, you know, there are situations, and I guess it's a good question, like, do we have a supply of tests that we could just give to people who are interested in having a test? I'm not saying to do the actual testing, but if someone wants a test kit for the next town meeting, right? If they don't have one in session 1, but they wanted a test for session 2, can we, as a town, be providing these test kits? You know, just like on the town election, they were giving out test kits.
Yep, you were giving up
So-
the last one.
So we,
Very limited supply right now. In fact, I think in the office, we maybe only have 70 kits. Right, 70 kits. I do have some coming in if the date is uncertain though, so I just can't guarantee we would have them.
I mean, I guess that's the
In a
question.
sufficient supply.
No, but the question of if I think on moderator or select board or others who are running town meeting feel like it's important to be able to ensure that town meeting members have test kits, perhaps they have some budget line that they could allocate to get some of these test kits. I think, again, what I'm thinking about is the recommendation, and I think as Maureen said, I think the recommendation to have recommendation testing beforehand makes sense. I think we're all in agreement there. This recommendation on making available the test, maybe the wording we can change for use of the venue, take that away, but make available right for that, just
As supplies allow.
as supplies allowed.
Yeah.
That then said, we recommend the testing be accessible. You know, because I don't want anyone to say, well, I would have tested, but no, I didn't have a test and I don't want to go to CVS and spend the money for it.
Yeah.
You know, I just want to make sure that we as a town are are saying testing is a good strategy. we
No,
wanna
no.
Make that available.
I wholeheartedly agree, and that's why I think just testing before is a better option.
So that's about the testing, and I think about the masking. There's no right way to approach seating when it comes to a large group. There's always going to be mobility issues, people that want, like, have hearing challenges that may want to sit closer or further away. I think, many of us, right, when we were in school, we were back of the room people, or front of the room people, or left side people, or right side people. That's sort of the way people are. And people will sit with their precinct captains, they'll sit with people that they know already. I mean, I understand that there's going to be a lot of dynamics at play, but I think in a situation where you are bringing together people not for they're coming together for governmental purpose, for an elected purpose. This is their job that they were elected to do. They come from various backgrounds. They come from various areas of, where they are in terms of their own personal health risks. And you're right, some of them may be, and then they may choose to wear masks for various reasons. I think the safest way, again, from a public health perspective, is to say there is an area of the auditorium which is reserved for people that are masked. And it doesn't have to be the whole auditorium. It can be a sort of small section of the auditorium. There are going to be plenty of people who would choose not to do that, that's my guess. But I think it would, especially because we can't have a remote participation option. I think that, someone who is severely immune compromised and is wearing a mask will probably choose to doubly distance themselves.
I'd be in the cafeteria.
So I think
outside.
I think we just need to be very careful. I agree that I don't want to, there's no right answer. I mean, in many ways, the right answer is just to require masks, but I don't have an appetite to mandate masks, because you're absolutely right. Well, if we're doing that, why are we not mandating masks for everybody else? I mean, town meeting members are different than school kids. I mean, they are in general a larger age range. There's more elderly people who are still town meeting members. It is a slightly different population. But I think, again, these are recommendations around masking that are not so foreign to big corporate conferences and corporate events and educational conferences and medical conferences. And what we do in the hospital, we mask, because that's what we do, because we think that there's, if there's one person in that room who could die of COVID, why not have everyone wear a mask? So, we could be to that point of saying, let's mask everybody and let's require it. But I think a middle ground here is to say, we recommend that you wear a mask, particularly if you're unvaccinated or immune compromised or living with someone that's immune compromised. But if we don't have everyone masked and we're not requiring that, make a safe space for people who really feel that strong. And I'm not going to speak for the people that feel that strongly, because there are people that will, this will prohibit their participation in town government. And I think we just need to make this will, I think, allow for that feeling of at least some security that they are sitting in an area where they don't have to worry about an unmasked individual in an indoor space for several hours, 5 nights or 7 nights. And that's why I think that's there. I mean, and there's no perfect way, but that was why I think, again, the recommendation is there. And as I think, as you said, this is a recommendation. This is not a mandate. This is not a requirement. But from a public health perspective, I think we as a board can make these recommendations.
I am in agreement, and underscoring that it is a recommendation, but I articulated that beautifully, and I am in agreement with that it would be a very reasonable compromise between a total mask mandate and simply a mask optional recommendation. But with these spacing out availabilities that are iterated here by Dr. Siriki. Would you like to make further comments before we do anything further?
I'd love to clean these up, just to tighten them up so they're actually realistic.
Okay.
So 1 is stricken.
Yeah.
2 is essentially, it's the last sentence. The exterior doors to the dining commons should be left open if possible, and the doors to the auditorium open to the dining commons. Because
The rest of it isn't.
It's not necessary.
3's already being done.
Yeah, the dining commons in the auditorium at the Winchester High School is places where the town meeting members can sit. We are also allowing outside if they would like, in their cars if they want. They could broadcast it on their phones and come in as well. So we're not just those 2 locations. we are streaming.
We have that technology. It's going to work for the cars just with a 2-minute lag time to get in and vote.
Mhm.
Is that what I'm hearing? Great.
You could do it if you make it, but you also know as a town meeting member, you know when the vote's coming
Oh,
up.
yeah, yeah.
So you take your phone and you start walking towards if you're going to vote.
Can I ask you just a question? Was your plan prior to the first town meeting to send all these things out to people?
If we were in person?
Yeah, just so like everything you've been working on, right? Your plan was to send a communication.
Oh,
Yeah.
absolutely. But what I was saying
So
is,
I guess my point is I think most of the things in your communication are going to be covered by most of these things because they're just the general public health
yes,
that's out there, right?
Yeah.
Most, this is just fully in line. There's some deviations to sort of doors being open and stuff, but this document is full and sort just what the public health data is, public health is recommending right now.
yeah, that's the other thing is, so one of the
So I
reasons
just don't want to have a separate document, I guess, in my mind, to be confusing. So in my mind, if you're planning to send something out that is just basically the regular old health and safety data from the Department of Public Health and Mass, which this is just the same thing, it seems a little redundant to me to have two different documents. And I think that the only thing that's different on here than what you were thinking was having a separate area to be actually fully masked.
yeah,
Yeah. And that's still under your purview to adopt or not adopt. We can only recommend that, correct?
yeah. At
So
this
this
point.
this-
And I just got to think about it a little bit more because we need to get a better understanding of what the other needs of our members are besides just mask or not. We also have those who struggle with seeing the screen and they need to be closer. And so there's all sorts of logistics in the mapping of, it's like a wedding, right? So where you put, and there, if you take a mask only section, you put them in the back, you put them in the right side, all of it has meaning to town meeting members. They're very historically driven on, and
I would
not
not recommend writing one. Yeah.
that's what I mean. So there's a lot of things going on.
Works.
Well, I do think, and I guess
That's
these
what I
are the
have to go
global
through.
issues that I want to say that I think that you're already thinking through these.
Mhm.
And so in my mind, you're using the current public health data that is out there from this department that I can't say how many times we've pumped out through these meetings and everything else. So the only difference would be whether or not you actually had a mask optional section, and that's under your purview anyway. So in my mind, I don't know if we need to vote on the second document if you're already planning to put that communication out.
No, and I think this actually helped lay it all out. The recommendations on the things I didn't discuss is coming from you though, right? Attendees should be up to date on their vaccinations, including boosters. Attendees are encouraged to test with their tests each day, right? That's all
That's just the
coming from
general
you.
public health data, yeah.
Yeah, but you're meeting before town meeting, correct?
We are meeting at 4 or 4:30 before town meeting the day of. Yes.
Yeah,
we
so
can
actually
change
it's
that. We
one
can do it
through,
again.
it's 1 through 7 are all.
Being done.
Yeah, well, 7 can be taken off. Everyone's allowed to be masked whenever they would like and
Yeah.
not masked when they would like. So, right, it's
Wait, 7.
Again, I think
I-
just because something's written there, I think it's a recommendation from us as a board, and I think
well, can they be unmasked while speak? That's can go either way.
correct. I think that's okay. I think
Yeah.
being unmasked while speaking is okay, but I think there have been situations where people have been said, asked to take off their mask, in a public forum. And I think it's just, again, a recommendation saying that people should feel comfortable doing what they feel comfortable doing. Again, these are recommendations from a public health perspective. And I think it is our job as the Board of Health to be looking at public health issues related to large town gatherings. And that's what town meeting is. And so, I understand that a lot of it comes from the DPH recommendations. If we weren't following DPH recommendations, we're not this sort of, rogue board that's going to do something completely different. We want to follow DPH recommendations. We want to follow what the state is doing. And so it's a good thing, but I think it's important for us as a board to restate and actually formally endorse a set of recommendations for the town.
Well, so I agree with that. And I can include it's the messaging. So what I'm worried about is if you come out with your own messaging, you send it, and I come out with mine, it's not clear. So I would like to merge them. So your messaging is in line with mine. I don't think there's much. The only thing is the mass seating.
Mhm.
And I think at this point, if you wanted, you can make a motion or whatever to recommend that to me. I think at this point, you need to do the recommendation to me, but not to town meeting. And let me do it.
Absolutely.
that's
yeah.
so- It's the messaging. So what I'm asking is, can you give me a few minutes to make it so it's clear of how I would write it to town meeting and then come bring it back to you and just say, you agree with the
So I
recommendation?
guess my question is, if we make recommendations, that the recommendations is not, it doesn't have, I don't think has to be a cut and paste, you send it to town meeting members. I think
Right.
we make recommendations and then as town moderator, you adopt the recommendations as you see fit and put out the messaging as town moderator, town meeting.
The recommendations to me.
The
Yeah,
recommendation
so
is to
the
you.
vote to you, the vote this afternoon would be that these are recommendations to town meeting through you. And you do, I'm not envisioning that we're sending these to town meeting members independently.
Yeah.
Are you in agreement that that would be the process, that we are recommending to the town moderator who's running a town meeting?
Yeah, yes. Well, the only other piece of this that I would like to state is I believe that the recommendations are in line with everything that we've been saying, except for the mask optional section versus no section. I personally, as someone in your role, don't believe that I would want a recommendation made to me that I can't think that I can uphold because of the other things that are going on, because now that puts it solely on you that you are not following the Board of Health's recommendation. And I don't think that that's a fair position to put the moderator in, and I don't think that's a fair position to put the board in. So for me personally, I would like the logistics to be worked out to see if this could even happen before I put that pressure on you personally. Because if I was in your position, I don't think I'd be, because in essence, if you don't follow this recommendation, what you're doing is not following what the Board of Health has recommended.
That's correct.
So personally for me, that's how I view it. But again, that's just my thoughts.
Mhm.
And I also, in agreement with Ruth and Greg, believe that we should be telling people to distance and test and mask and all of those other things. It's not that I'm not saying that we shouldn't be pushing out the public health recommendations that we've been pushing out for 3 years now. You should be vaccinated, you should be boosted, you should be all of those things. I just don't want to make tangents on things that are going to make it very difficult for you to run a town meeting that is inclusive of all, including people with visual disturbances, hearing disturbances, age, et cetera, outside of COVID. COVID isn't the only thing that we're thinking about with bringing 192 people into a room. And so that would be my last or final comments on it.
Thank you, and I do hear where you're coming from, very valid place to be coming from. I would like us to reach a point of agreement this afternoon rather than try to defer this to the hours before town meeting. So we could play with the sentence, the wording in 7, but ultimately it comes down to whether it is practical for Madam Moderator to be able to deal with this, and whether, I am in agreement that we should have some area where people who want to attend town meeting members who would like to mask up do not have to sit in the assigned place with unmasked people on either side of them. That there is some kind of accommodation, whether that is people in the cafeteria are masked up, whether that is people in the auditorium are masked up and everybody else is outside only to enter when there's votes, whether that is, in the furthest regions where the public usually sits at an angle, and, whether that is a masks only section, whether there can be, I don't know whether the ventilation is excellent. I don't believe that an additional freestanding ventilator is going to change that in any way, but I don't actually know about that. But whether I would like to see some way that we can accommodate folks who want to attend and do want to be masked up, and to the extent possible held in not held, but have an area where they do not have to sit for 4 hours a night for 3 to 5 nights, hopefully not 7. As was mentioned earlier, but that, just basically have that responsibility of being present and not being comfortable there.
Do you have public comment today?
We do.
I see that there's a lot of town meeting members. Is there ability to listen to what they have to say in response to the conversation before you vote? Would you consider that? Just so I can hear what they have to say.
Yes,
Is that
I don't
okay?
have any problem with that unless my colleagues do.
No,
Okay,
Is that okay?
okay. So we're gonna table this. No motion was.
I'll stay here.
Yeah, please.
Okay.
Now, let's see. I need. So we are. Okay, we are skipping over old business and new business, which I don't believe we necessarily had any, but we'll check at the end to see. And we are going to public comment. So I'd like to note that the Board of Health welcomes input from members of the public. I'd like to remind everyone that the purpose of public comment is to permit members of the public to express their opinions on matters which are within the purview of the Board of Health. It is not a dialogue, and the board is under no obligation to respond to comments or questions. We request that speakers are respectful of board members, staff, and the public, and that comments are directed at policies and actions. And please refrain from personal comments about any individuals. We request that speakers who are in present come forward and sit at the table so that the audio can be picked up by the recording. You are asked whether here or remotely to please state your name and full address. Comments are limited to 2 minutes per person, 1 comment per meeting. The total amount of time we are striving for 10 minutes. And we will start with anyone who is in attendance. Go ahead, Jeannie.
Excuse me, can they also spell their last name? Because
Yes.
I'd like to have them correct, and sometimes I'm not
I hear
close.
you. So we will be asking folks to spell their last names. Is there any member of the public who's present today who'd like to come forward in person here and speak? Yes, please come forward. State your name and full address.
So I'm Mara Sullivan, 28 Stone Ave, Winchester, Precinct 1, town meeting member. So I am obviously wearing a mask. I wear a mask in public. I'm planning to wear a mask to town meeting, and I would really like a section that was reserved for other people who feel the way I do. I don't think people have to sit in that section if they wear a mask. They can sit anywhere, but if they want to sit in the section, they can. And I would like that option. Otherwise, I'm not going to feel as safe. So I really, really hope that the town moderator considers that, because other people I've talked to that feel the same way also would prefer to have a section that is sort of safe, and other people are in your mindset and are wearing a mask. The second thing is with regard to tests at the venue, probably we don't have enough for everybody, but if we could even just have some in case anyone is there and they start to feel funky, they can take a test right there on the spot and see whether they're positive. And then third, these are just what you're doing tonight, in my view, is you're just putting forth recommendations to the town moderator to decide whether she wants to adopt. It doesn't mean if she can't follow for logistical reasons, anyone's going to criticize, in my view. It's just recommendations from a public health perspective. So I hope you will vote on a document today. Thank you.
Thank you, Ms. Sullivan. Is there someone else present here who'd like to speak? If not, then Regina, could we see who's available?
Pamela Court.
Ms. Court.
Hi, thank you. Pamela Court, 112 Arlington Street, Precinct 5. The first thing I want to say is that I deeply appreciate and recognize the expertise of all 3 members of our board, and that I'm grateful that you're not all in lockstep because it makes for better discussion and better decisions. So I've appreciated everything that you've all brought to the table and all of the comments and the discussion, which I've learned from and I think is very helpful. I'd also just like to add, although Ruth mentioned it in the rules for public comment, that I hope that when people are commenting publicly that they address issues and stop with the personal attacks on any of the board members. None of you deserve it. You all work hard. You all put yourself out there. And so a thanks for that and a call for people to just be kind to all of you. That said, like Maura Sullivan, I'm also concerned about my safety. I'm watching the numbers go up, and I have a comfort level or a lack of comfort level with being in a room for many hours, even in a separate section, because Virus particles, like any colloidal suspension in air, such as smoke particles. Smoke particles are solids. Virus is a liquid, but they behave the same way. If you can imagine, a non-smoking section in a restaurant doesn't really protect one's lungs from the secondhand smoke. So to me, whether or not there's a separate section, if I'm in a large room with many unmasked people, I'm less apt to feel comfortable. So I wanted to thank everybody for their suggestions, and the moderator in particular for offering up some solutions for folks who, like me, will not feel comfortable being in there, because I deeply want to participate in town meeting and not have to skip, because I consider it a duty and a responsibility. But I also feel that if I don't feel safe, there's no town government business that is worth me risking my health. Thank you.
Thank you, Ms. Clark. I saw someone appear and disappear.
Yeah, Stephen McCabe appeared, but no, I don't see
Yeah,
him.
put his hand down. So there's no other hands up.
The owls are working, so if you wanted to go on video through your computer.
The owl is
It's
not.
not working.
I don't know why.
I have no need to be on, I mean, you mean video? Surely, I can certainly start the video there. There was one hand up. That person seems to have disappeared.
There's another hand.
And we still have time. There is one more there if we'd like to.
Mary?
You're muted. You're
Can you
muted.
unmute, please?
Thank you. Thank you for all the work that you're putting into this. I know there are a lot of people that are concerned and had questions, and I appreciate the work that you're doing to try to address this. A quick question.
Excuse me, can we just have your name and spell your last name and your address, please?
My name is Meredith Mason Crowley. It's MASON-CROWLEY, and I live at 10 Hines Road, and I'm a precinct 1 town meeting member.
Thank you.
I'd like to know, usually at town meeting, the public is able to come in. Now, will the public be allowed to come in? How is, I didn't quite hear how that element would be handled. Will the general public, if they want to come in and attend the town meeting, be attending? And
Discuss that. Do you want to address that, Madam Moderator? My assumption is yes, but under the same.
They won't be in the
regulation.
auditorium, they'll be in the cafeteria. If they want to speak, they'll let staff know and staff will notify me, but they're not allowed to speak anyways until town meeting accepts.
right.
But they'll be available in the cafeteria.
Okay. And the other was you mentioned about the airflow in the cafeteria, in the auditorium. I think you're asking about air exchanges, and it's I've seen it measured in another school system, and so that's the question to ask the whomever is responsible for that, is the amount of air exchange in the room, and does it fit a particular criteria? So that's just a suggestion if you want to feel comfortable with the quality of the air exchange. That's just the last comment I have.
So I'm told, I don't know whether you can hear the audio here, it's a little bit unable to pick up, Ms. Crowley, but the DPW has evaluated that, and it is adequate for the numbers of people that there are seats in the auditorium for.
Okay, so it has been tested and determined. Okay.
Yeah, because when it was
Right.
remodeled. Mrs. Crowley, when it was remodeled, they got a whole new system and it was tested at that point in its functionality of it. And it's one of the best that we have in all of our town buildings.
Okay. All right. Well, thank you. Thank you.
And thank you for attending. It looks like there are no more hands, is that correct?
No hands.
All right, then we are going to close public hearing, public comments. And move back to where we were. Madam Moderator, did you hear anything that you wanted to incorporate in what we're debating?
I think it goes back to there is no perfect solution on how we do it and how we support. Like, you have one person who's okay with being in a mass section, one who just doesn't want to be in the auditorium, period. And so it's very difficult on how to navigate everyone's personal needs, and we can just do the best that we can with all the restrictions and try to look at the big picture. You can make a recommendation of me. I cannot promise I can do it based on all logistics that have to take place. There's people who want one seat. They don't want anyone else to come near. There's people, right, who want their assigned seat and they want to just know that they have their space and it's their space for every night. And there's a lot of different needs and a lot of requests coming in from town meeting, and navigating all of that is very difficult. And so if we get a mass section, how do you, it's just how we have to look at it and look at it further and look at all the logistics of it out of the isolation that we're in.
I have a suggestion.
So I completely agree that there's no perfect solution when you think about the various layers of mitigation. You know, we could, as a Board of Health, say you need to mandate vaccine. We're not doing that. We could say you're mandating masks. We're not doing that. Because those are all things we could easily say as a board, and saying we want to make sure that everybody in the venue is vaccinated, masked, and tested. Like, and there are clearly meetings to do that, you know, in professional settings that require proof of vax, proof of testing, and a mask. We're not recommending a mandate for any of those three. And I think this document puts together a very fair, appropriate, public health grounded recommendation. There's no recommendation that's going to be easy to follow. I think that my belief as a member of the Board of Health, looking at the public health global needs, is that, you know, the minimum that can be done from a theory perspective is to think about a mask, and we strongly encourage and recommend a mask always.
And we're not making recommendations about where or how to do that, but in thinking it over, I think it's a very reasonable recommendation. And there are multiple ways in which I think it could be accommodated. So I'm in agreement with certainly not taking that out. We could soften the wording, but I think that there's no reason really to do that. We might want to possibly have a survey sent out that would be anonymous to return, but to get a sense of, is it 2 people or do we need 200 people to have a masks only section? So that might make it a little bit easier to plan for that. At this point in time, I think we need to move to a vote on the recommendations that we would make.
So I just have 2 other comments.
Go ahead. Yeah.
One comment was just in one of the public comment things. It's someone said that they
Which
would
number?
feel
Oh,
they would feel safer because they would be sitting with people of a similar mindset, and that's one of the issues around masks that I have is just because someone has a mask on, they could be day 11 from COVID. So I just want to be clear that I get that the mindset is, and I get that people feel mask and anti-mask and all these other things, but there are many other layers in my mind that go into masking. And so I would like to encourage that people, you know, we can recommend that everybody wear a mask, we can, you know, whatever. But so I just want to make sure that people understand that mindset, that because somebody has a mask on doesn't automatically mean that they're fearful of COVID, immunocompromised, they could have COVID, there's so many reasons. They could have a mask on that has nothing to do with COVID. So I just want to make sure that we're clear that just because we have a mask optional only section, that we're not saying that necessarily that's the safest section for these people to sit in, right? So it may be safer for them to be in their cars or in their dining commons based on their own personal reason for either wearing a mask or not wearing a mask. So that's just one thing I want to be clear from the board, is that just because we're providing this mask optional section, it doesn't mean that we're providing a safer place for someone to sit in the auditorium, in my mind. Now, you guys can disagree if you want to, but I just want to make sure that if we are messaging this out, that I'm not telling you that you're any safer sitting in that seat than you are sitting in your car. Well, you're safer sitting in your car, but I'm not telling you that because you're sitting in that section that you are safer than sitting in any other part of the auditorium. So I'd just like that to be clear. And I want to make sure that if we are going to message number 7 out, that is clear somewhere in the language. The second thing is, I think that if you, again, want to recommend a mask optional section, I think that the language should say that we would recommend or something, not provide, because provide to me says you have to do it. And I think right now we don't know, if we want to vote on this document tonight, I think right now we don't know whether or not you can provide that for the public. The mask optional section.
Number 7.
Number 7. So I'm not, so I guess in my mind, the clearest message, the most concrete message, which is what I like to put out in my mind, is we should be recommending all of the current COVID mitigation strategies. So A, you should be symptom-free. B, we recommend that you test before you come. C, we recommend that you wear a mask. D, we recommend that you space. And did I say vaccinated? And E, we recommended that you are fully vaccinated. So for me, those 5 points, this document to me is very noisy. So the 5 points that I pull out of this are, you should be vaccinated, you should have a mask, you should not come if you're sick, you should test before coming, and you should wear a mask. And so
that Maureen, is all there in the recommendations for town meeting members. You've exactly laid out.
no, I know. So I'm saying the rest of it just feels noisy to me. And I feel like the message gets lost a little bit, but it could be also that I, the message a little bit gets a little bit lost to me, because it's, if we're in line with the measures that we put out, that Jen puts out, and every communication that we put out from this department and from this board, those are sort of our 5 messages. And if you need help getting a vaccine or a booster before town meeting, we can help you do that. If you need a test, we can help you do that. But I think that other than that, I think that oversteps the reach of this board, because I don't think that what we're saying is we're providing you with a safer place to sit because we're saying you're sitting in a mask section. I don't think that that's providing that.
I respectfully disagree, and I think we are absolutely saying the same thing in terms of what we think attendees should be recommended for. I think we're 100% in agreement there. But I think it is within our purview of the Board of Health to recommend mitigation strategies for venues.
No, I'm not saying, I'm saying we should be recommending, I don't know how my message got lost. We should absolutely be making recommendations. My point is what I am saying is that I'm not telling you that if you're sitting next to a masked person who just got over COVID 10 days ago, you're any safer, if you're safer sitting next to them than if you're sitting all the way in the very corner of the auditorium all by yourself alone. So all I'm saying is that I'm saying that if we provide a mask only section, I just want to be clear that may not be the safest section for you to sit in. Correct?
I think it may not be safe to have town meeting in person. I mean, I think some people would just say.
Right. I mean, obviously we can go round and round and round. I'm just saying.
There's zero way for us to come to a conclusion and say what's the most 100% safe thing. But town meeting has to occur as we started our discussion and saying we want town meeting to occur in person.
Right. So again, mitigation risks. Life is about mitigating risk, right? So we are trying to mitigate risk for the people in this town who have to attend town or who choose to attend town meeting. My point is that I think that most people can agree that just because we're providing a mask optional section, that may not be the safest person for the most immunocompromised person or the oldest person in town to sit, right? If they could sit in the Commons, if they could sit somewhere else. So I just want to be clear in the messaging that for you, for your personal risk, just because we're providing this, that may not be the safest place for you to sit. And so I just want to be clear that someone who maybe, I'm not saying whatever, but maybe isn't savvy, maybe isn't in on meetings, isn't anything, sees a mask optional session, they're severely immunocompromised, they go sit there because they think that this is what's being provided to them. And it's actually safer for them to be in the Commons, it's safer for them to be in the car, it's safer for them to be in the left-hand back corner of the auditorium. So that's all I'm saying.
Absolutely right, and I think that comes from our job. I think is to participate in the messaging, but also to lay out the recommendations. And there's often a disconnect between sort of what sounds like formal recommendations and then what messaging can be. I think we also stated right in the recommendations here that we want alternate spaces, and that sounds like that's been already worked on. If there were no alternate spaces, I think we'd be in a very different situation. I think if you had said. If we had said there's no cafeteria option, there's no way to stream anywhere else, I would be much more in favor of a mask mandate, period.
Wholeheartedly.
And so I think here you're sort of having levels, right? And I think town meeting members can make a choice based on these recommendations, but I think we need to allow for those choices to occur. And so again, for me, it's about a recommendation that it's not a mandate, but a recommendation to town moderator about how to most effectively in the current state run the meeting in terms of the venue.
But again, the piece that I'm asking you to say, just all of that I agree on. 100%. The piece that I'm saying is that I think that we're sending a message to people that by sitting in that section, that is the safest place for them to sit.
I'm not saying that, Maureen. You keep saying that, but when I'm looking at this, there is nothing either in any point in this document.
So if you walked into the auditorium with a mask on,
Mhm.
and you are severely immunocompromised and you are not open to this meeting and you did not see this document, and you see a mask-only section, is a person, do you think that that person would think that that's the safest? If that person asked me as a medical provider, I would tell them to sit alone in the furthest reaches or to go back to their car or go to the commons. I would tell them not to sit in that section because the option of that section having people just coming off COVID, people who have been exposed to COVID, and that's why they're wearing masks, that would not be where I would recommend that person sit.
Well, then why not just a mask mandate then? I'm asking you a question. I mean, I think if that is really the stance of, for the lowest, the denominator of the person who's at most risk, the safest thing for them would be to either not be at the meeting at all in person, which we can't do.
Right.
Be in a remote location, which it sounds like we can do, but potentially suboptimal.
Right.
Or be in a room full of everyone masked.
So again, agreed. But again, should that person be in a room full of everybody masked or not? Should that person be in their car? Should that person be in the comments? I believe that what the moderator and the town and the DPH has done, DPW has done, is tried to make a comprehensive plan for everyone who is coming to this meeting. And so in my mind, I want to be clear that as a recommendation from the board, if you have, I don't think it's a good recommendation from the board to say that there should be one section that people should sit masked in, because the reason, and I get back to this like-minded mindset. In my mind, masks don't have anything to do with politics, and masks don't have anything to do with like-mindedness. Masks are a safety and mitigation strategy to prevent the transmission of COVID. And so in my mind, I say that if I had just been exposed to COVID and I'm on day, whatever of my exposure, the CDC recommends that I wear a mask indoors. So I would be sitting in that section. Is that the safest person for me to be sitting next to somebody? No.
I think, we are hearing.
Right. So that's why I'm just saying everything that we recommend, I agree that we should recommend all of these things. And I agree with you, Greg, that if town meeting was only going to be happening in this room with no other options for streaming, which has been very inclusive, or the commons or the doors open and all those other things, with the town data currently, maybe we should be at a mandate. Okay. But with the current data that we have in the town and the other options, people to be viewed, to holding a vote to 2 minutes so that people can come into the auditorium, all of these things are being considered. I'm just saying that I think the additional layer on top of that of saying we're going to have 1 or 2 sections of just mask optional sends the wrong message. That's it.
Okay, so we've heard that message. And I think, I'm wondering whether with that, there is any way that you can look at number 7 and see whether we can word this in a way where we can reach some kind of a compromise, where the recommendation still clearly is from us that we have this section, but that it is with some kind of messaging that I do not see in anything here that the message from the Board of Health says, you're safe if you sit over here. We haven't called it a safe section. We've called it a masks only section. So
That's the problem, actually.
yes, please.
So the mask only, if you are a town meeting member and you're not reading the emails and you're not reading everything, and you show up to town meeting and you get the map, right? And you get the map of the seating chart, and it says mask only section, you're coming in with the mask, that means that some people will interpret it that they need to go sit at the mask only section.
So message it then. That's the best way to message it.
I don't know how to do it, but that's how they're gonna interpret it, is I have to wear a mask, I need to go to the mask only section. So someone would interpret it that way.
I think we can deal with this in the emails that go out to town clerk or through other vendors or people simply there. I don't think, because messaging is a challenge, and some people might mishear by looking at a map, that we need to say we want to fundamentally change the recommendations. I think these are very sound recommendations. I'm willing to look at the wording in number 7 to see whether we can tweak it in some way, which acknowledges that the message is, this is a mask only section for those people who choose to be there. And if you choose to wear a mask, but you want to sit anywhere in the auditorium or the cafeteria, you are also welcome. You're welcome to wear a mask or not wear a mask when you're at the mic and so forth. That we are providing a requested and from our point of view, a necessary or recommendable accommodation, a very reasonable accommodation for holding it in person, doing all we can to bend over backwards to hold an in-person town meeting without any kind of draconian measures at all. So I respectfully hear your concern. I think that the messaging is important. I don't think anyone on the Board of Health is saying, come on in, it's healthy if you sit, it's totally safe if you sit over there. No one's saying that. So, I'm comfortable with the document as it is, but if anyone would like to offer any recommendations for tweaking the wording on 7, otherwise I would recommend that we move forward. And considering that, first of all, are there any tweaks that? Go ahead.
And you can strike number 9, because that's set by the bylaws, the amount that they speak, so we time it, so you don't need to have that one that's already set.
Yeah.
And 10 is also on the same way, the presentations and everything are set by times.
And you're already restricting seating near the microphones.
Yeah.
You're already spacing out the seating.
Yep.
You're already providing KN95s.
It doesn't,
Well, but
make, no,
I
they
think
can be
again,
recommendations.
but I think again, you can put a
Yeah.
recommend, if you're volume.
Oh, no, I know. I'm going through to see that you're already doing, I'm making sure that all of these are being done.
Yeah, I just think again, just because I think
Yeah.
we should leave them in because
Yeah.
I mean, if we make a recommendation, we're making it from a public health perspective, and it's being implemented, then it's a synergy. It's a win-win. I don't see a reason to then go strike that.
Well, I think you actually can change it instead of recommendations, is that we are in agreement with the town meeting moderator for all these items. That's, I think, what's coming down, is it's not a recommendation, is we are in agreement on all of them.
But I think we're
The
making.
asking
Yeah,
section
but
is
we
something
do
I.
We're
have
making a
to-
recommendation
yeah,
as a
we
board.
have.
I think, I think, again, we're making a recommendation as a board. We can set policy and make recommendations. And our entire discussion has made me want to think about whether we should just be mandating that. Because we could supersede all of this by just saying that. But I'm not gonna move to do that because I think that there is a way to thread this needle. Yeah, I understand it's nuanced. This whole pandemic is nuanced and there's no right answer, right? We could have mandated that the meeting be shut down and go virtual because of our concern about rising case rates. And we could be saying all those things. So I think with that in mind, I'd like to just, again, say that I think what we have here is a very reasonable set of public health grounded recommendations. And I think there is support from the board to do this.
I am in agreement. Are there any other tweaks that you, okay.
I'm pretty sure they outline everything that is.
That you would like, yeah. And regarding messaging on number 7, I think we should just let it ride, but Ms. Pimentel, if you can find a way of messaging 7, either that you'd be more comfortable with, we can certainly entertain that.
I guess, when I look, again, I know I'm belaboring the point. So I guess it just, says someone's attendees has been exposed, they must wear a mask at town meeting. So they're going to be sitting in the same section as other people. So I don't know what it does
We,
from a health perspective.
number 7, provide for one or more clearly marked masked only sections within the venue. And then we follow that with, I don't exactly know what wording to provide, but between that and ensure these sections have access to microphone, I don't know quite what we can put in there, but, understanding that this is not a guarantee for safety or I don't know if there's any caveat.
Well, I think that caveat is for the entire document. There is no caveat.
Yeah.
There is no 100% safe in-person gathering of 200 people at this current state.
Yeah.
We would be wrong in saying that anything is safe, but this is, I think again, it's a recommendation.
And we do,
I actually think, though, it is safer for people to be 6 feet spaced apart, masked or unmasked. I mean, it just, I think that distancing and masking.
kind of says a lot of that, and does give a bit of caveat to that. And even the sentence, the Winchester Board of Health strongly recommends that the following mitigation strategies be adopted to reduce the risk to the Winchester community in connection with the in-person spring 2022 town meeting. I think that adequately addresses the point you're making, Maureen, but.
Yeah, no, I mean, we can vote, that's fine. My two problems are, one, the messaging, and two, if it's not something the moderator can enact, then, it's holding our feet to the fire a little bit, but we can vote, that's fine. I think we've talked about other points.
So, Ruth, I'd like to make a motion to vote on the document as you have amended. in our discussion.
I will second that. We'll take a roll call vote. Dr. Sawicki?
Aye.
Ms. Benatar?
No, only because of 7. Everything else I agree with.
And Ms. Tremarky votes yes. So it's a 2-1 vote. Thank you. Yeah, thank you for the commentary as well, and robust discussion. All right, let's take a look at where we are. I am pretty sure that, is there any old business that we need to bring to the table? Any new business that we care to bring to the table at this time? If not, we can entertain a motion to adjourn.
Move to adjourn the meeting.
A second, we'll take a roll call vote. Ms. Pimentel? Aye. Dr. Sawicki?
Aye.
And Ruth Charnecki is aye. That's a unanimous vote to adjourn the meeting. Thank you to the public listening in. Thank you to the public in the room. Thank you, all of the staff who have attended as well. Thank you so much. And now keep it up.
Recording stopped.